Have you ever wondered if your blood pressure numbers are truly working for you, actively protecting your heart and brain? Understanding your ideal range is one of the most important steps you can take for your long-term health. For most adults, the ideal target blood pressure is less than 120/80 millimeters of mercury. This optimal range significantly lowers your risk of serious health issues, especially conditions like stroke and heart attack. Keeping your blood pressure in check is a powerful way to safeguard your future and ensure your arteries remain as healthy. Blood pressure is essentially the force of your blood pushing against the walls of your arteries as your heart pumps blood throughout your body. When this force is consistently too high, it is known as hypertension or high blood pressure. Over many years, uncontrolled high blood pressure can quietly damage your arteries, causing them to stiffen, narrow, and become less flexible. This arterial damage increases your risk for a variety of severe health problems. For example, it can lead to blood clots forming, which might then travel to your brain, causing an ischemic stroke. It can also weaken blood vessels in your brain, potentially leading to a hemorrhagic stroke where a vessel bursts. While less than 120/80 is a general healthy guide for the public, it is important to understand the broader categories. A reading between 120/80 and 129/89 is considered elevated, and anything at or above 140/90 is classified as high blood pressure or hypertension. Your doctor considers your unique health profile when setting your personal target. This includes important factors such as your age, your family medical history, and any existing chronic conditions like diabetes, kidney disease, or cardiovascular disease. For instance, someone with diabetes might have an even stricter target to protect their kidneys and blood vessels, while an elderly individual might have a slightly more flexible target based on their overall health and risk of side effects from medication. To actively manage your blood pressure and work towards your personal target, consistent action is key. Start by regularly monitoring your blood pressure at home with a validated device, keeping a log of your readings, and bringing these records to your appointments. This provides valuable data for your healthcare provider. Crucially, engage in an open and honest conversation with your doctor about your specific target. They are your best resource for interpreting your numbers and tailoring a plan just for you. Lifestyle adjustments are incredibly impactful, often making a significant difference. Incorporate a heart-healthy diet rich in fruits, vegetables, and whole grains, such as following the dietary approaches to stop hypertension, or DIA-SH eating plan. Aim for at least 150 minutes of moderate-intensity physical activity each week. Make efforts to limit your sodium intake, manage stress effectively through techniques like mindfulness or deep breathing, and completely avoid smoking. If your doctor prescribes blood pressure medication, taking it consistently and exactly as directed is absolutely essential for maintaining control and reducing your stroke risk. It is incredibly valuable to understand that the top number, called systolic pressure, measures the pressure in your arteries when your heart beats. The bottom number, known as diastolic pressure, measures the pressure when your heart rests between beats. Both numbers provide critical insights into your cardiovascular health. High blood pressure is often referred to as a silent killer because it typically presents with no obvious symptoms until it has caused significant damage. This makes regular blood pressure checks, even if you feel perfectly fine, and adherence to your personalized target absolutely essential. Early detection and proactive management are your best defense against the long-term complications, such as stroke. By knowing your blood pressure numbers, understanding your personal target, and actively embracing consistent, healthy choices, you are making one of the most significant investments possible in your brain health and overall well-being. This proactive approach is about preventing disease, protecting your vital organs, and securing a vibrant, healthy future for yourself, free from the risks associated with uncontrolled high blood pressure.